Question number 6, labor and delivery. So Maggie states she wants an epidural for pain. I can't take it. The anesthesiologist comes and puts an epidural in. So 3 to 4 interventions. We want to educate her about pruritus, palpitations, vertigo, and a metallic taste in the mouth if the epidural is placed in the wrong place. Patient needs to be elevated on the bed, preferably with an empty bladder. And we also need to show them the proper placement to sit on the bed as well as the appropriate way to bend their back when the needle is being placed. These are all things that the anesthesiologist will reiterate, but we as the nurse also need to discuss these with the patient as well. We also want to fluid load the mom with 300 to 500 of normal saline or lactated ringers because it's going to help prevent the maternal hypotension and the fetal bradycardia. We also prep the equipment needed for after the procedure, such as having a Foley in the room because we need to start a Foley in the mother afterwards. After the epidural is placed, the fetal heart rate goes into the 60s for 2 minutes, so this would be considered a prolonged decel. We do 5 steps for intrauterine resuscitation, which is turn the mom on the left side for the inferior vena cava syndrome, check the blood pressure, O2 8 to 10 liters nasal cannula to get the oxygen to mom and baby. We do an IV bolus, normal saline, helps with the maternal hypotension and fetal bradycardia. And we could do TURB to help decrease uterine contractions if necessary, and we stop Pitocin as well. If we're going to be providing assisted delivery, the 2 steps that we would take for the maneuvers would be the McRoberts maneuver and the suprapubic pressure, as well as gasket maneuver. These are different ones we can do. McRoberts is when the baby's head's getting hung up on the pubic symphysis bone, which causes the shoulder to get stuck on that. So with this maneuver, the mom's legs are pulled back and hyperflexed so that her pubic bone kind of lifts up a little bit. Suprapubic pressure, we're taking our hand and we're pushing down on the pubic area to help kind of like push the shoulder of the baby out so that it can be delivered. And then the gaskin is when you go onto all 4s, hands and knees, to help kind of position yourself as well as the baby inside the uterus. We want to, nursing interventions, medications that might need to be ordered would be Methergin to prevent the postpartum hemorrhage, Hemabate, Miso, Cytotec, Oxytocin. For Hemabate, the contraindication is asthma, and then for Methergin, our contraindication is hypertension. How is QBL determined in contrast to EBL? QBL is actually quantitative blood loss, and it's the best way to measure because it looks at a scale of quantified data versus EBL, which is estimated. It's more subjective, and it's more of a guessing amount rather than the data.